Has your dog been making strange breathing sounds like this? Here's what's going on and what you can do to help your dog. Hello, welcome back to my channel. If you're new, welcome. Click there to subscribe, hit the bell to sign up for notifications. Then when you click the link directly in the box below, I can send you a copy of my free book. This here is little Winston. He's about a 12-year-old beagle pug, but he's been having some really unusual breathing problems. And this is what's been going on.
It's okay, it's okay, it's okay. Poor little guy, poor little guy.
Do you not think that's pretty distressing? Really, it looks like he's having a challenging time just getting enough air in. I'm going to slow the video down a little bit, and as you can see in a little bit of a slower motion, what's actually happening is Winston is drawing air in through his nose in reverse. He's making that snorting noise while he's inhaling. This is called a reverse sneeze. It looks really dramatic, but most of the time it's not actually that serious. And surprisingly, this is really common in many dogs. There's some type of irritant, in the nasal cavity, in the back of the mouth, that's triggering this sneezing. Possibly it's an allergy. Maybe it's some type of growth, like a nasal polyp. Some dogs can get a type of a mite called a nasal mite. Other dogs, they can even have tooth root abscesses. If they got an abscess tooth, that's protruding up into the nasal cavity, triggering this reverse sneezing. So if your dog is reverse sneezing, do you need to rush off to your veterinarian and see him or her right away? This is actually really common. So most of the time, and I saw many dogs in veterinary practice that had signs of reverse sneezing, most of the time we never actually even figured out the obvious underlying cause. Maybe it's springtime and it's seasonal allergies. Definitely I saw higher incidence of reverse sneezing in the spring. If your dog has occasional bouts of reverse sneezing, which seems to be the majority of dogs, in general, it's not something you need to worry too much about. If there's a sudden onset of reverse sneezing, like say the episodes of reverse sneezing are increasing, or it's just not going away, well then that needs to be investigated. So with Winston, we did a little bit of an exam. Winston's appetite is down, he's not eating as much. His owner is saying he's not really chewing much on the right side. He seems to have less energy. Watching him walk around, he's just not feeling 100%, which, makes me think, is there something else going on? In looking at Winston's mouth, as they lift up his lips, you can actually see one tooth here, which is markedly abscess. Winston, he's got a tooth root abscess. The big upper fourth premolar, also known as a carnassial tooth, it's got 3 big roots, and those extend quite far up. They're almost at the tip of the nasal cavity. So as you can imagine, if you've got an abscess, one of those tooth roots abscessing, that can get right up into the nasal cavity. So what's that doing? That's a huge source of irritation for Winston. Guess what? He's reverse sneezing. Unfortunately for Winston, it's not an easy fix. He's going to see a veterinarian. He's going to need general anesthesia. He's going to need to have that tooth extracted. But once that tooth is extracted, he's going to feel so much better. One last point I wanted to add in is while I was practicing, we see many dogs with reverse sneezing. Someone had increasing prevalence of it, and we'd be like, what's going on? One of the possibilities is a nasal mite. Fortunately now, this is a pretty easy thing to treat and rule out. One thing I suggest is this guy, Revolution. The actual name of the drug, Revolution, it's selamectin. It's a class of the ivermectins, and it's really effective against the nasal mite. So if you have a dog which has got increasing episodes of reverse sneezing, you've seen your veterinarian, you've got an examination done, there's no obvious other underlying causes, it's never a bad idea just to rule out possible nasal mite. 2 to 3 doses of Revolution given every 2 weeks apart. In most cases, that'll rule out the nasal mite. I want to thank Winston's owner Trevor for letting me check out Winston. Secondarily, recording Winston doing that marked reverse sneeze, because I think it's just really helpful for you guys to see what a reverse sneeze looks like, and if your dog is doing something similar, maybe your dog has what Winston has. Thanks so much for watching this edition of Veterinary Secrets of Reverse Sneezing, and specifically what was going on with Winston. and how we're going to help him. Click up there to subscribe, hit the bell to sign up for notifications, and then when you click the link directly in the box below, I can send you a copy of my free book.